Honourable member for Mississauga-Streetsville.
Mr. Speaker, I will be sharing my time with the Honourable Member for Whitby. I am pleased to speak today on the health portfolio's critical work with the World Health Organization and other international organizations. The importance of international collaboration and cooperation has never been more clear. No single country, including Canada, is able to solve complex health challenges alone. As we know all too well, COVID-19 and other viruses and health issues do not respect borders. That is why the health portfolio engages, cooperates, and collaborates with international and global partners. This happens multilaterally through the World Health Organization, the G7, the G20, and other organizations. We also engage directly with our international partners to strengthen our domestic response. As a founding member, Canada is a strong supporter of the WHO and engages with the organization to advance domestic and international health priorities, share health expertise, and protect the health of Canadians and people around the world. This includes contributing support and expertise to health emergency response efforts, such as the COVID-19 pandemic, developing a vaccine for Ebola, championing polio eradication, and advancing global health security. Canada also collaborates with WHO on issues important to Canadians, such as climate change and environmental health, healthy aging, mental health, and non-communicable diseases. Canada is strongly committed to advancing gender equality and the empowerment of women and girls. WHO is an important partner in advancing these objectives, including equity-based approaches to health systems, strengthening primary health care, and closing gaps in sexual and reproductive health and rights. Canada is a strong champion of gender equality and equity issues, and we bring this leadership to our engagement with the WHO. Canada values the WHO's leadership and coordination role in the COVID-19 response. The WHO has an important role in overseeing the international health regulations, driving global research efforts towards new vaccines and treatments, addressing shortages of critical medical supplies and personal protective equipment, helping global vaccination efforts, and supporting vulnerable countries and their preparedness and response efforts. We recognize the opportunity to learn from the COVID-19 experience and strengthen the WHO and global pandemic prevention, preparedness, and response efforts. That is why we supported the decision to develop a new instrument on pandemic prevention, preparedness, and response at the special session of the WHO's World Health Assembly last December. Canada will work to ensure that this new instrument enhances international cooperation, so we're all better prepared should there be another pandemic, while protecting Canadian interests. We also strongly believe we need to improve the tools and mechanisms that we already have, including the international health regulations. The COVID-19 pandemic has demonstrated that member state expectations for the WHO outweigh its resources and capacities. There are important global discussions taking place right now on improving WHO's sustainable financing and governance. Canada is emerging with other member states to address these issues and will continue to actively advocate for oversight, this organization, and implementation of key findings and recommendations from the Global 19 reviews. WHO has also an important role in crises, including the armed conflict in Ukraine, which has significantly disrupted health services and is having disproportionate impact on women and children. Canada is contributing to the WHO's overall health response in Ukraine, which is focused on saving lives and ensuring access to basic health services for those affected by the armed conflict. Canada has allocated more than $7.5 million to the WHO to improve essential health services in Ukraine, including emergency care for injured patients and continued COVID-19 care. These are important topics at the 75th World Health Assembly that took place this past May. Canada has a strong presence at the Assembly to advance the priorities we share with the WHO and other partners. This includes strengthening the WHO through enhanced leadership and governance, mobilization of global action to better prevent, prepare for, and respond to health emergencies, and accelerating progress on health equity and determinants of health. I want to reiterate that Canada believes the world needs a strong WHO and that a strong WHO should reflect a global health community where everyone is included and can participate. There are many actors contributing to better public health outcomes around the world, including Taiwan. They have been a good bilateral partner on Canada on health, which we saw when they donated personal protective equipment to us early in the pandemic. We continue to support Taiwan's full participation in organizations such as the World Trade Organization and the Asia-Pacific Economic Cooperation, where it is a full member. We also support its meaningful participation in international fora where there is practical imperative and where Taiwan's absence would be detrimental to global interests. Accordingly, and as consistent with Canada's long-standing One China policy, we support Taiwan's inclusion as an observer in the World Health Assembly. The Minister of Health called for Taiwan's meaningful participation in the Assembly during his plenary statement this year. Canada also continues to work closely with our G7 partners on both the pandemic and other priority health issues. Canada has participated in numerous G7 health ministers' meetings where we have underlined the need for collaboration to end the acute phase of this pandemic. G7 health deputy ministers are meeting in a week in Berlin where they will discuss critical issues such as ending the COVID-19 pandemic and implementing lessons learned, tackling the connection of climate change and health, and combating antimicrobial resistance. Engaging through the G20 has also been important for global cooperation on the pandemic. Under Indonesia's presidency, G20 health ministers met this past June and will meet again at the end of October. Canada looks forward to working with our G20 partners to help build resilience for the global health system, including sustainable financing, harmonizing global health protocol standards, and expanding global manufacturing and knowledge hubs for pandemic prevention, preparedness, and response. Health ministers also met with G20 finance ministers this past June, with a second meeting planned for November, to address the critical funding gap for global pandemic prevention, preparedness, and response. The health portfolio is working closely with G7 and G20 partners, as well as with international bodies and organizations, including the WHO, to address important global health challenges, including and beyond COVID-19, such as antimicrobial resistance, climate change, and mental health. The threat of antimicrobial resistance has the potential of being the next global health crisis. As our antimicrobial medications, especially antibiotics, become less effective due to pathogens developing the ability to resist these drugs, this is increasing the risk of disease spread, severe illness, and death. A truly global challenge. This is an issue where Canada needs to collaborate closely with our international partners and international organizations, including the WHO. The impact of climate change is on health and has become a global health priority. It is important that the connection between health and environment remain at the center of international discussions and actions to address climate change at the 26th Conference of the Parties of the United Nations Framework Convention on Climate Change. Canada supported the commitments for building and developing climate resilience and low-carbon sustainable health systems, which was recognized by the WHO. This is a transformational time for global mental health. The pandemic has had a tremendous impact on mental health and well-being, underscoring both the gaps and opportunities in our mental health systems. And so we need to translate this momentum into action and work together with the WHO and our international partners to ensure we achieve the goals and targets that we have set, with the vision to create a world in which mental health is valued, promoted, and protected, and mental illness is prevented and cared for equitably and respectfully. Canada has helped foster strong international relationships and the resilient global community needed to successfully face the challenges of COVID-19, to build back better as we emerge from the pandemic and continue to make progress on other health important issues that we know no borders. Moving forward, we will redouble our efforts to ensure that the WHO is effective, efficient, relevant, transparent, accountable, and a well-governed institution whose actions and recommendations are guided by member states and by the best available science and evidence. The world needs a strong, transparent, and inclusive WHO, and Canada stands ready to work with others to make this a reality. Thank you, Mr. Speaker.
Question.